Hello. As we know, the month of May is designated as the Mental Health Awareness Month by different mental health organizations and public health organizations. I am Dr. Deep. I am the program coordinator for community and public health in Rhode Island College. My background is in public health. My areas of interest have always been mental and behavioral health, but that's not the main reason why I am creating this video. Like many of us, mental health challenges rather impact most of us in some way, shape or form. Especially when we are in a college campus, when we are in a university campus, we have to think about the mental health of students, staff, and faculty members. Anything that I am saying here does not reflect the opinions or points of views of my employer. In terms of mental health of students in higher education, we all know that the COVID-19 pandemic has impacted. The COVID-19 pandemic has made a precarious situation even more untenable. Almost. It has impacted our lives in so many ways. But we cannot ascribe all of the challenges just to the COVID-19 pandemic, because much of these was there even before. Increasing student loans, even though we are having some conversations nationwide about these loan forgiveness. Honestly, I am not completely knowledgeable about the details of that. I would hope to know more, but I know that financial stress can be huge. I also know that when you combine that with the various demands that are placed from students, it can be overwhelming easily. As a faculty member or as a staff member, I can personally say, as a faculty member, is that less is spoken about that professionals can also have mental health problems, which is a no-brainer, because mental health problems do not need to differentiate whether you are a student or you are a professional. So about 3 years ago, I was diagnosed as having attention deficit hyperactivity disorder. That's a long story as to how I transitioned from being quite in denial, even though I was diagnosed. It didn't help that I was not explained well, and due to some preconceived notions, I was quite resistant. Now, I have a background in medicine from India, followed by public health. But ADHD as a whole, and especially ADHD among adults, is not a big topic. So I can summarize that I was quite at dark about ADHD among adults. Gradually, as I started learning a little more and relating it to my symptoms, not the attention deficiency part so much, although that problem has been there, but any ADHD expert will tell you, and I'm not an ADHD expert, I'm just trying to understand. Any ADHD expert will tell you that the inattention is barely the tip of the iceberg. There is a lot going on, especially in terms of executive functioning. I have always wondered why I feel sort of shamed and resentful whenever someone comes up with suggestions like, I need to be a better, more disciplined, better manager of time. I need to manage time better, all of which are evidence-based suggestions, by the way, to be more efficient, generally speaking. For neuroatypical individuals such as myself or anyone who is in the ADHD spectrum or autism spectrum, all of those suggestions can almost appear. I often compare it as similar to if we are telling a person who is paralyzed, whose legs are paralyzed, if we are giving them the advice that just move your legs and start walking and you will be fine. And I know that sounds a little bit extreme, but that's almost how it feels like, because most of the conventional suggestions of time management and planning and organization may not work. So long story short, please seek help. Please, as one of my professors used to say, or professors or one of the administrators back when I was in college, that probably this is the only time when you can access mental health support on campus, where you can access it for free, because it is actually not free. You are already paying for it. So make the best use of that, seek help from professionals. And there are challenges, but those can get a little bit easier with help. And last but not the least, the most important thing is the helpline numbers. If you are in distress, if you know of someone in distress, please reach out for help. And I hope you have a healthy and productive rest of the week.